I'm the team manager for Wellbeing and Recovery Services within Second Step. They're a leading mental health charity that cover Bristol, North Somerset South Gloucestershire, that have been around for about 30 years now, and a big part of my role is overseeing our Recovery Navigation services. Recovery Navigation support a wide range of individuals, people that are too complex for primary care mental health services. They don't quite meet that threshold for secondary care mental health services. Our aim is to kind of sit between that gap. Someone can be referred for recovery navigation support directly via their GPs, or it could also be via other mental health professionals like AWP. Recovery navigators require 2 years significant experience working with complex mental health needs. Within recovery navigation, we look to kind of put those building blocks in place to help people become a bit more independent and manage their own mental health once our support has ended as well. So that's always a focus from the start, with each individual on a basis that's specific to them. Personalised care is allowing each individual to have an input on the care that they receive. Recovery navigation uses this as their focus to their approach to supporting individuals. Allowing each individual to have a voice and have input in their care and their planning moving forward for their own recovery is an essential part of what we do. It's really important that they have an active part in their own journey. We're there to help guide and access support and different services if necessary, but we take that time to allow each individual to have their own voice, to work to their own strengths. We identify strengths, we identify priorities as well. We are a short-term service, so we need to be as targeted as possible. Positive impacts of our work can include helping people to live more of an independent life and to reduce presentation at other mental health services or GP surgeries for mental health reasons that can't necessarily be solved within those organisations or settings. We offer such a wide range of support, and some other positive outcomes is helping people back into employment or volunteering opportunities, or making those initial steps to be ready to start integrating or reintegrating back in with society as well. There are some crossovers with social prescribing and recovery navigation as well. The standout is that we both, as differing services, can help people access local support groups, services, anything in their local community that could be a benefit to them. This could be art groups, walking groups, even kind of low-level CBT courses as well. Recovery navigators are offered ongoing development and training within their roles to meet the needs of the population that they're working with. This could include things like personality disorder training, dual diagnosis training, working with individuals in a trauma-informed way. One of the most enjoyable parts of this work is working with people in a holistic way, allowing each individual to have their voice and have an active part in their own recovery, making decisions, making suggestions, coming up with action plans. That is a huge part to allow someone to feel like they have an actual part within their own recovery journey.